Beak.
Root.
The het.
Tony?
Taff.
Yeah.
Speech therapy is a really varied career, so you can work with individuals of any age, so from newborn right the way up to elderly. I love the difference that you can make to individuals' lives and to those of their families.
Being a speech and language therapist is the best job you can have. Every day is really different, every day is interesting.
And as speech and language therapists, we're really fortunate to be able to choose which area we'd like to work in. So whether you want to work with children who perhaps have developmental communication difficulties, or whether you perhaps want to work with adults who might have acquired communication difficulties as a result of perhaps neurological damage. You might choose to work with individuals who stammer, or individuals with voice difficulties. You might work for the NHS, you might work for charitable organisations, or you might work for independent practitioners or services as well.
Here at Newcastle we have 2 undergraduate programmes. There's a BSc Honours Speech and Language Therapy, which is a 3-year course, and the Integrated Masters in Speech and Language Sciences, which is a 4-year course.
We use a whole range of techniques on the programmes, and from day one students are supported to be reflective learners so that they can become reflective practitioners when they're working as speech and language therapists.
We've got a high number of clinically qualified academic staff, so all the time we're bringing that mixture of clinical and academic knowledge to our teaching with the students.
We also use some novel and innovative teaching approaches, such as case-based problem solving, where rather than feeding the students the information that they need to know, we support students to learn and to apply their knowledge to real-life cases as they would out in clinical practice.
And we have some really excellent expert patients who come in as well. So for instance, when we do our teaching about laryngectomy, there's a group of people who have laryngectomies who come in, and the students are able to talk to them and spend a day with them and actually properly learn about what it would be like to have a laryngectomy.
Students learn about every speech, language and communication disorder that they may work with, or that we as speech and language therapists might work with.
Every student, when they arrive, is assigned a personal tutor, and in most circumstances you have the same personal tutor throughout the whole of your course, so you can get to know them really well. All our programmes are approved by the Health and Care Professions Council, the HCPC. We're also accredited by the Royal College of Speech and Language Therapists, who are our professional body. They provide us with curriculum guidelines, and they also check the content of our programmes. Our graduates are really, really employable and getting jobs very quickly as well. We have a module in the final year which really prepares them for professional life. It makes a bridge between their academic learning and their professional duties. So they learn about legislation, the structure of health services, all the sort of guidelines that speech and language therapists have to follow. And we've heard back from service managers as well that they really look out for Newcastle graduates, which is really good.